I'm joined by Dr. Jennifer Thomas, a board-certified family medicine physician with Morris Hospital and Healthcare Centers. She completed a primary care psychiatry fellowship through UC Davis in 2018 and is the medical director of integrated care at Morris Hospital. Dr. Thomas sees patients in her Braidwood and Gardner offices. Great to have you on this morning as we want to spend a little bit of time talking about a topic that probably could be spent a lot of time talking on this topic, children's mental health awareness.
Yes.
You know, especially during this pandemic, mental health, I think everybody's become more aware of their own and others' mental health, and specifically kids.
Yep, I think it's at the forefront of all of our minds, whether we're adults or children. It's affecting all of us in one way or the other, for sure.
Sure. Well, what are some signs that parents might notice if their child's having a mental health concern?
Yeah, absolutely. So parents might notice several things if their child is having some mental health issues. There might be a change in behavior or some new mood swings. The children might express excessive worry about numerous topics. They might get withdrawn from things they used to enjoy, like hobbies or socializing with friends. Some children with mental health issues can appear sad or sort of hopeless. And sometimes there's disruption in sleep, either sleeping too much or the opposite, having difficulty with sleeping. And some folks might even experience change in appetite, so eating too much or too little, or even expressing thoughts that they'd be better off dead or hurting themselves in some way.
Okay. In your introduction, I mentioned you're the medical director of integrated care. What is integrated care?
Yeah, I'm glad you asked. So integrated care is a philosophy of whole-person care. So we're attempting to address the physical health concerns alongside the mental health concerns. And integrated care is a team-based approach to behavioral health, and it's delivered in the primary care office setting. So you can think of it as like a one-stop shopping mindset for health care. The model of integrated care that we're using with Morris Hospital is called collaborative care. And what collaborative care means is that we're adding 2 new care team members to the primary care doc's team. So we all are pretty accustomed to having a primary care doc or a general physician or a pediatrician for our kids. Collaborative care brings in a care manager, so this is typically a social worker or counselor that can do some counseling in the primary care office, and a consulting psychiatrist. So the whole team helps identify and address a child's mental health needs.
Okay.
And it also takes a population-based approach, so we keep track of these children in a registry, so we can actively reach out to parents if maybe we haven't seen them in a while, or maybe they're not improving. We can reach out and try to address those issues early on.
Well, how should parents go about seeking care for their child with mental health concerns?
Sure. So it's always a good place to touch base with the school system. Even our teachers, even in the time of COVID with hybrid learning, they have eyes on our children in a way that parents sometimes don't, and they can observe things. Even most schools will have guidance counselors, social workers, or even school psychologists that can help identify those needs. So even with hybrid learning, I would encourage parents to touch base with the school system to see if they've observed any concerning signs. And then, the primary care provider, the pediatrician, that's often where most patients enter the healthcare system. And, a pediatrician might be able to screen and diagnose and treat a child's mental health concerns. And if not, they can hopefully coordinate with the parents and refer to a higher level of care, a specialty mental health setting, but at least help the parents make that connection.
All right. And how do you feel the COVID-19 pandemic has affected children's mental health?
It's not a surprise to anyone that, this pandemic has been difficult for all of us. Some of the infection control measures that we've had to do, the quarantining, the social distancing, it takes its toll, whether you're an adult or a child. Humans were social creatures, so while these measures, they're absolutely necessary, we got to get, control of the spread, it doesn't mean it's not difficult on all of us, including our mental health. And children in particular, this is probably a challenging time. Kids, they thrive on routine and predictability. So when they lose those routines and their schedules become disrupted and changed, it makes it difficult for them to function. And children often look to the adults in their lives, their parents, their adult caregivers, adults in their family for that steady reassurance. And adults could be struggling with this too right now. Adults have their own anxieties and frustrations about how everything is going and the unpredictability with the pandemic. So it's tough. But I would still just encourage parents to, talk to their kids. Start off with just a caring conversation of, how are you doing? How can I help? And if kids can do little things for themselves, as a family, it's always a good advice to get outside, get some exercise, get some sunshine. Maybe you bundle up and take a walk or go sledding. But if some of these supportive measures aren't helping, then I would encourage all parents just to seek out. Maybe start with a pediatrician, start with the primary care provider, and get that evaluation early on.
All right. Well, then, and I think this is pretty much what you're alluding to about what parents can do to support their child's mental health.
Yeah, absolutely. I think, be involved, ask questions, don't be afraid to, seek care, whether it's, a sprained ankle or a physical concern. If it's an anxiety or depression, mental health concern, just as important. And hopefully that primary care provider can tackle it themselves, or if not, point you in the right direction to get care that the kids so much deserve right now.
All right, very well. Well, Dr. Thomas, thanks for spending some time with us this morning. Certainly appreciate it.
Absolutely, my pleasure.
Dr. Jennifer Thomas with Morris Hospital and Healthcare Centers. Morris Hospital and Healthcare Centers is known for its compassionate and personalized approach to healthcare. With 1,400 employees, including a medical staff of more than 200 physicians, they stand ready to improve your health at 25 convenient locations. To learn more about the primary care providers near you, visit morrishospital.org and search the online provider directory, or call 815-942-2932. You can request information there as well.